Breast cancer is among the most common cancers globally. In Jamaica, it is the leading cause of cancer-related deaths among women. 1 in 21 Jamaican women will be diagnosed with cancer. Hi, I'm Kediesha Watkis, and this is the Wellness Beat. Here today to talk with me about a riveting journey is Manager for Public Relations and Communications, Mrs. Petre-Williams Raynor. She's a breast health advocate, author, wife, and mother. Welcome, Petre.
Thank you for having me, Kay.
It is Breast Cancer Awareness Month, and no doubt a special time for you. As we're talking about breast cancer, walk us back to the moment when you discovered that something might be wrong with your health.
Right. Well, it was 2020 in the heights of COVID, and it happened around about the time of my birthday, in fact. So I was born on September 7th, and my husband and I, because COVID was so intense at the time, my husband is a journalist, and myself working in public health, you would realize that, again, a very intense time for us. So with my birthday coming around, we thought we would use the opportunity to take off to the North Coast, catch a little breath of air, and then of course come back to Kingston to dive back into things. So we went down on September 11th, in fact, so a few days after my birthday. And the very evening, while getting ready to go to dinner, I just so happened to lean forward while in the restroom, and my breast touched my arm. And I tell people all the time, it was as though the tumor nudged me, because in that moment is when I felt that there was a mass there. And so I immediately, of course, called to my husband, my go-to, my first choice of second opinions. I said, Raynor, come here 1 minute. And so he comes into the restroom, and I say, I think I feel a lump. And he's like, okay. So he checks it out for me, and then he says, yeah, man, babes, I feel there's something there. But my husband, wonderful, wonderful man that he is, Raynor, he said, look, we're not going to freak out. We're not going to assume that this is cancer. We're going to have instead a wonderful weekend, and then we'll get back to Kingston on Monday. Then we would go see the OBGYN and hear what they have to say about it and move forward from there, which is what we did. Suffice it to say that that was not something I ever anticipated discovering. And so I suppose at the time I wasn't alarmed. I mean, people sometimes ask me if in that moment I felt alarm, and I didn't. You're working in public health and you're sensitive to some of these things and the possibility that they can occur. But I have no history of breast cancer in my family. I had no symptoms of anything, except that I was perhaps a little tired. But that was expected because it's in the heights of COVID. Everybody's tired and stressed.
Yeah.
Right? And so I was calm in that moment. So we had a blast of a weekend, thankfully. Maybe the last blast of a weekend
for a while.
For many months to have come, right? Then we got back to Kingston now for Monday, and I went in to see my gynecologist, and he said, yes, in fact, there is something there. There's something there. And I was referred to do a breast ultrasound.
And then came the diagnosis.
Oh, yes.
So here you are, birthday celebration, setting sail into the sunset, and then this anomaly, this mass.
Yeah.
What were some of the day-to-day challenges following the diagnosis?
Okay. Well, I think I want to give you a little backstory about the diagnosis. So you go to the OBGYN on the Monday, and he says, well, you need to go do a breast ultrasound. And of course, you don't readily get the date for the breast ultrasound. So you have a few days to have Google become your best friend. And so I think as a woman, when you face the possibility that you could have breast cancer, you do go through a kind of phase where you're like, surely God, this is not it.
This is not it. Something else.
Something else.
Tell me Google. Breast mass.
Google.
What's something else, not cancer.
Exactly. Which is precisely what my process was. And so you had these options of fibroadenoma, you had the possibility of cyst, and I was honestly grasping. I was hoping. I was like, God, please let it not be breast cancer. Let it be one of these things that is quickly managed and dealt with. Alas, I went to my radiographer and we did the exam. I mean, in point of fact, when I got there, they said, normal modus operandi is for you to first do a mammogram, and then if we pick something up in line with what you've observed, then we would go ahead and do the breast ultrasound, which is what we did. By the end of that time, though, I had not just done the mammogram and the breast ultrasound, but I went straight ahead and biopsied the mass. And one of the most jarring things, because from the point of, you know, going on Google and trying to figure out what are the alternatives to breast cancer, it really didn't come home to me that this is a thing. But when I went to the doctor and she performed the breast ultrasound and then they produced the report, I recall the last line of the report said, suspicious of a carcinoma.
That's when it hit home.
Oh my God.
Yeah, that's when it hit home that you were facing a life-changing, life-altering moment. But your husband would have been there. So here you are, Petre, setting sail into the winds on a beautiful birthday celebration, but you've discovered this mass. Describe what were some of the day-to-day challenges following diagnosis.
Right. Well, I think one of the first things you have to tackle once you have been diagnosed with breast cancer is getting your health team together.
Right.
You know, and so I had the wonderful surgeon, Dr. Leopold Powell, who really supported myself and my husband through that process. One, helping you to kind of understand and appreciate the process that you are starting,
Yes.
and then putting us on to different members of what would then comprise my health team, including my oncologist and so on. And then once you have crossed that hurdle, you know, the decision about whether or not you're going to be doing a mastectomy, which is the removal of one or both breasts, given the scale of what it is that you're faced with.
Yeah.
And so, you know, sort of going through that process was also difficult. So in my own instance, it was determined that I would be doing chemotherapy, and we would be taking what is considered, or what is called, a neoadjuvant approach. I feel like I'm saying that wrong. But essentially, it is where you do the chemotherapy first and then breast surgery would follow thereafter.
Okay.
And again, just tough processing all of that, understanding the disease that you are faced with. I mean, one of the things I got to know coming out of the experience is that not all breast cancers are the same.
Right.
So in my particular instance, my cancer was considered, or found to be rather, hormone sensitive. And so therefore, after you have done the chemotherapy and the mastectomy, if that is your choice so to do, then what can follow is hormone therapy, which of course is intended to improve your chances of avoiding recurrence of this cancer. And so, again, the hard part of it, the day-to-day, was just kind of processing a lot of information coming at you. And of course, your health team is not dictating to you what is to be done,
But
right?
they're introducing options.
Exactly. They give you options, and you have to now make the space to understand those options, and then, of course, working with them to kind of figure out the best course of things.
So this would have been a lot of decision making.
Right, absolutely.
And possibly hard decisions to make in a short amount of time. But words like mammogram and screening quickly became part of your vocabulary and in your life in general. What was that adjustment like?
You know, I think you and I, Kay, were having this conversation, I think yesterday or maybe a couple of days ago, that I am super grateful for my faith, and I feel that the Lord has really been on purpose in my life, because in my own instance as manager of PR and communications at Ministry of Health, those words were not foreign to me,
to you,
right? You know, we do the campaigns.
Right in the health ministry.
Exactly. And so when it came time now to really sort of, I suppose, internalize those words, it was a little bit easier, because it's like I would have been prepared based on the campaigns and so on that we have done. That notwithstanding, it's a hard road. At the time, I was 39 years old, and like I said, there's no history of breast cancer in my family. This is not something I'm anticipating. And so to, again, process all of it and then know to understand that there are some necessary and quick steps that would need to be taken, right? Also, post-treatment, you know, mammograms don't go away. You have to
do them.
Exactly. You have to do your annual mammograms. You have to check in with your oncologist. You have to check in with the OBGYN. You have a whole set of people you have to check in with. And so, yes, it is a hard road, but I'm very grateful for my experience of being at the Ministry of Health, for the wonderful friends I have, the colleagues, the wonderful colleagues I have, my family, everybody who was supportive. Exactly, exactly.
What about I mean, we're going to be talking with Dr. Deerie Cornwall on the other side of the break, but how about your day-to-day habits since diagnosis and recovery? Did anything change for you?
I think initially, you know, post-recovery, you become super sensitive, hypersensitive. You know, there's a narrative about sugar, and then also you will see the data telling you that as a breast cancer survivor, you help to reduce the possibility of recurrence if you are more active and so on. And so you become hypersensitive about some of those things. You worry about what you eat, you worry about if you're doing enough exercise, and then critically, in my own instance, and I suppose particularly based on the advice of my my gynecologist, is the management of stress. So sometimes as individuals, we're able to, you know, very readily adjust the diet and very readily increase our physical activity. But the stress management portion of it is something that I myself struggle with. You know.
But even in that, what would be your final message to our viewers? You know, what's your message, even as you found yourself making different steps to rebound from this disease?
Well, I came across a quote on Instagram recently, and it said, "It doesn't matter if it's hard, it matters if it's possible." And I will say to women that, yes, breast cancer is a hard journey to take. I would not wish it on my worst enemy. However, it is possible to beat this disease. And therefore, I encourage women to really, you know, take heart in that, to be inspired by that. I also want to, you know, sort of put it out there that I have chronicled my story in this book called I Am Not My Breast. And one of the reasons for this title is that during my own journey of, you know, making those decisions about what aspect of care to pursue and so on, it came out that women very often struggled with, for example, whether or not to remove a breast or breasts, because we understand what the culture is and so on. And my encouragement, therefore, to women is know that you're not your breast, and that what is important is for you to prioritize your chances of survival. So do whatever it takes to survive.
Making some hard decisions on a hard journey. Thank you so much, Petre. We're going to be talking with Dr. Deerie Cornwall, radiologist, head of the UHWI Women's Center, and she's going to give us some more of the technical information. We're so happy to continue this conversation here on The Wellness Beat. Stay with us. Welcome back to The Wellness Beat. I'm your host, Kediesha Watkis. We've been having a heartwarming talk about breast cancer, and it's Breast Cancer Awareness Month. We're going to get into the technical details about this disease, and joining me here today is Dr. Deerie Cornwall, consultant radiologist and head of the UHWI Women's Imaging Center. Thanks for being with us, Dr. Cornwall.
Thanks for having me.
You know, Doc, if we were to poll people in a room and ask them, how many of you know someone with breast cancer? I think most hands, if not all, would go up. Why such a prevalence of this disease in our population?
Well, first up, we know that the breast is the most common site for cancer in women in Jamaica. It is projected that 43 or so out of every 100,000 women in Jamaica have breast cancer. And that boils down to, if you go in a room and there are 21 women, 1 out of every 21 will have it. That may be a little of an understatement, because if you go globally, according to the global data, it's 1 out of every 8 women.
1 in 8?
Yes. So if you have a room with 16 women, 2 would have breast cancer. So if you have an office, you go to church. In your church you have 80 women, 10 are projected to get breast cancer. If you have a classroom, a school, you have 8 teachers that are female, 1 is projected to get breast cancer in their lifetime. So the breast is the most common site for cancer in women in Jamaica, and that's a fact.
That's a fact. It's a startling fact.
Yes, it is.
A very startling fact.
Yes.
And you know, among the key things that people want to know about breast cancer is, what causes it? What is the cause? I don't know if you have an answer, but what is the cause?
I know, because everybody wants to fight the big C. So when we look at causes of cancer, there are causes that we have control over, and there are causes that we do not have control over. So let's talk about the ones that we do not have control over. Being a woman, gender, getting older, age. Those are 2 of the biggest risk factors for getting breast cancer. So that's gender, that's age. Then we speak to your family history, the family you're born into. If you're born into a family with genetic predisposition for breast cancer, having breast cancer in your family, ovarian cancer, there are some cancers that are linked to breast cancer. So if you were born into that sort of family, there's an increased risk factor, right? So your genetic predisposition or your family history, your being a woman, getting older, your ethnicity. We black women tend to get more aggressive cancers at a younger age than whites. So these are factors that we may not have any control, because even if you're bleached, you're still black, right? So, but of all of that, what I want to focus on is the being a woman and getting older.
Yes.
Because there are women who would say, you see this conversation is not for me. My family don't have no cancer in it. It's only little pressure and sugar that my grandparents have. I have no cancer in my family. I want to get to the women who don't have any cancer in their family. Because the women who have no cancer in their family, or even women who have, being a woman and getting older is all you need.
That's all
to be at risk for breast cancer as we get older.
No genetics necessary.
No genetics necessary, right? And so those are the factors that we don't have control over. Then we have the factors that we have control over, and that is things like your diet. You know, decreasing fat in the diet can decrease the risk, help to decrease the risk of getting breast cancer, and not only breast, others. But having a diet that is low in fat, getting to your ideal body weight, because overweight, fat produces estrogen, and that estrogen, adipose tissue, that estrogen can help to increase the risk of getting breast cancer. So obesity isn't good. Yes. Fat isn't good. So try cut back down and get down to as ideal a body weight as possible, right? Exercise also helps with preventing or fighting breast cancer, right? Limiting alcohol and smoking. These are factors that I think we know, yes, right? So alcohol, smoking, getting to your ideal body weight, decreasing your fat intake. These are some factors that we have control over, and getting your fruits and your veggies in and stuff, you know, to build up your immune system. These are some factors that we do have control over to fight breast cancer. But what I want to say is that even if you have the best diet or the best lifestyle, and you have all those factors of you're not overweight, you're slim, you don't have any alcohol, you don't take alcohol, you don't smoke, you have children, because yes, you know, if you're nulliparous, as into not having kids, that may be an increased risk of getting breast cancer. You're breastfed, even if you do all of that. Once you're a woman getting older, you are still at a particular amount of risk.
Wow. So you said a lot a while ago, Doc. So I felt heartened when you started to talk about the nutrition and the exercise, and I'm thinking, all right, so our overall health, if you keep on track with your health, you may well be decreasing your risk. But then again, you have said even with all of that, there is still some amount of risk.
Yes, because you cannot totally decrease the risk down to zero. Maybe you can, but we don't know. So the thing is that being a woman, getting older is the biggest risk factor for breast cancer. Now, that said, the lifestyle factors do help. Because if someone was to get cancer at 50, you push it off, you may push it off until 60 or later. So the lifestyle changes is saying, God, I'm going down the road of my life. I'm going to try to do as much as possible with my lifestyle choices, so that if I am in my choices, if cancer is coming up the road towards me, I am trying to do as much as I can to push it off.
Yes, yes.
But we don't know if we're going to push it off to the point where we push it away and it never reaches us, and when we die of old age.
Yes. But what we do know is that there can be some action.
Yes.
So then, what would be the warning signs telling me to take action?
I like that question. Let me tell you why. The earliest sign of breast cancer is nothing. Normal feeling. Good, good, good. Good up and airy. So most women will say, okay, so I am listening to this program. I don't have no lumps in my breast, which is a sign of breast cancer. I don't have any nipple discharge, which is a sign of breast cancer. I don't have any changes to my skin. The skin doesn't look like an orange peel, you know. I don't have any excoriation or a rash to my nipple. These are different signs of breast cancer. I don't have any lump under my arm. What we want people to get is that everything starts somewhere. And what we want when we catch a disease is that we catch it before it tells you good morning.
Before I feel anything, before I see anything.
You want to start checking so that if a cancer is there, you catch it early, and then you can deal with it, throw it away, lock the door and throw away the key. That sort of thing. That's the best chance of a cure.
And so then, we talked earlier with a guest who has gone that journey of breast cancer, discovered a lump, no predisposition, no other signs. From your standpoint, Dr. Cornwall, what is the first step after having discovered this lump?
Okay. If you have a lump, so let me divide lumps into age categories. We encourage all young ladies from teenager coming up to examine themselves. If you ever feel a lump, then visit your doctor, and your doctor will advise whether you should do an ultrasound or a mammogram or a check to check it out. Now, when a woman who reached the age of 30, we advise that all women at the age of 30 go to their doctors to check to see if they are at risk, increased risk from their genetics and their family history and stuff for getting breast cancer, because some women may have to start doing their breast cancer checks as early as 30.
And so you're talking about maybe a mammogram might come in at an earlier
stage. Right? You know, I don't like how I answered that part. Let me tell you why. You asked me about a lump. I should talk to the lump first, because the fact is that everybody who have a lump have to get it checked.
Yes.
Right? But I didn't want to come back to before a lump is felt. So let me start over that.
Definitely.
So if a woman has a lump in her breast, any woman at any age at all should get that checked.
Okay.
There is no room for feeling a lump and not checking it.
Yeah.
So our friend here earlier had a lump and got it checked. Right? And so anybody hearing me, if you have a lump at any age, whether you're a teenager, 20s, 30s, 40s, 50s, 60s, 70s, 80s, 90s, 100, any age, any lump felt must be checked. Right? So that takes into account the women who already maybe have a lump.
Yes.
I want to move you to the other scenario of a woman who doesn't have a lump. Right? If a woman, so all teenagers, young ladies coming up, 20s, 30s, 40s, you're coming through from teenagers, you start checking your breast. Anytime you feel a lump, you get it checked. If you don't feel a lump, then you should be fine. Now, when you've reached the age of 40, that's where the tempo changes. If you have no cancer in your family, and you're fine, your breast them feels fine, you have no lump in your breast them airy, then you need to start getting your yearly checks done with a mammogram to check the breast to make sure that they are okay for truth. You feel your breast feels fine, you need to check with a mammogram to see that they are fine, because the mammogram can pick up lumps before they can be felt, up to 2 to 3 years before they can be felt.
So this is at age 40?
It's at age 40.
Every year?
Every year. That is if you are not from cancer family. A woman who is from cancer family may have to start her mammogram some as early as 30. So what we really advocate is that all women, when you've reached the age of 30, you should get a visit with your doctor to do a check to see if you're in the category that have to start at 30 or wait until 40.
Wow. You know, I may have to bring you back to talk a little bit more about this, Doc, but resources. We want to know, what are the resources available for women out there as we wrap this chat up?
So we have breast cancer conversation. After starting to talk about your health and you making good choices, starts with a mammogram in terms of screening. And screening is looking for disease before you can feel any symptoms. So that starts with mammography. And in Jamaica now we have mammography in the public sector at the Kingston Public Hospital. We're trying to put it in at Cornwall Regional Hospital, where they are, going through the phases. Mammogram is there, Cancer Society, University Hospital of the West Indies, and of course the private sector. So there are mammography machines available that people can get it done. Okay? And if a woman does a mammogram and something is picked up, whether they felt a lump or not, then we move on to an ultrasound, and there's ultrasound available at the public sector as well. If we do an ultrasound and we see something, the next thing that we may do is a biopsy, where we take a piece of the lump, test it to see if it has any features of cancer. And that's where it can be confirmed by a biopsy.
Yeah.
After that now, if it is confirmed to be cancer, we do what is called a receptor testing, very in detail test to see the typing of the cancer, because some cancers are more aggressive than others, and the type of cancer would tailor the treatment that is necessary. So there's a type of testing that we do called receptor testing on the sample that was taken for the biopsy, to kind of type the cancer to see if it's triple negative, estrogen positive, HER2 positive. So we type the cancer.
Yes.
And then now we do things to stage the cancer, like a CT scan of the chest, abdomen, and pelvis, a bone scan. We do blood tests and stuff, and then the surgeon comes into play now to decide if they need surgical treatment to do a mastectomy or lumpectomy, which is a wide local excision, or whether they need to get chemotherapy or so before surgery. So the treatment for cancer is very hopeful. Very hopeful. There has been so much advancement in the treatment for breast cancer that there's a lot of hope, because there's so many agents and treatment available to shrink the tumors even before surgery, and the chemotherapy and the hormonal agents that we have now is so advanced that we are in good stead. We are in a good place. We still have more to go, but we're in a very good place. Breast cancer is not a death sentence. What we want to encourage all women, breast cancer is not a death sentence. We all know that being a woman, getting older is the biggest risk factor for getting breast cancer. So everybody listening should know, okay, am I reaching the age of 40? If you reach 40 and you haven't had a mammogram done yet, book and get a mammogram done. Right. When you've reached 40, you don't need a paper from a doctor to get the mammogram done. Just go and get it done.
And so we're saying the resources are here.
The resources are here.
It starts with a mammogram,
yes,
and then the medical specialist will take it from there. Dr. Cornwall, it's been such an important and excellent talk with you. These conversations are so important. I feel like I could talk to you for the rest of the day, but that's all the time that we have. And I am so delighted that the Wellness Beat was able to premiere this episode for you here in Breast Cancer Awareness Month. Dr. Deerie Cornwall, such a pleasure to have had you with us, consultant, radiologist, and head of the UHWI Women's Imaging Center. Thank you so much for watching. I'm Kediesha Watkis. We'll see you next time here on the Wellness Beat.